Have you heard of functional medicine? Are you confused about what it means compared to conventional medicine? We're going to get all those questions answered for you because we have an integrative and functional medicine doctor here today, Dr. Mordy Levy. Hello and welcome.
Thank you for having me.
Functional medicine is getting more and more attention these days. But first thing, we should find out what it is and what it means exactly. So tell us.
So functional medicine is a paradigm shift in the way we look and assess chronic diseases. It's a form of lifestyle medicine. It's a personalized medicine. We're trying, always the goal is to look for the root cause of disease.
So rather than cover up the symptoms,
That's right.
You want to figure out what's causing it in the first place and go there.
Exactly. It's also called the medicine of why. We're good at labeling conditions, symptoms, and prescribing medications for specific illnesses, but we never ask the questions why. Why do we have those symptoms? Where are they coming from? Are they the results of lifestyle issues, nutritional deficiencies, hormonal imbalances, genomics, environmental influences? So all those variables are very important in functional medicine.
Wow. And so I guess essentially you're trying to bring the body back to its ultimate wellness point, right?
Exactly. The goal always is to, while we reduce the symptoms, is to maximize functions and improve wellness at the same time.
And when you're dealing with the root cause, the symptoms go away.
Most, yeah, in many cases they do.
It must be so gratifying to see people get better, like really get better.
It is, and that's in a nutshell what functional medicine is about. Hence the term functional medicine. We maximize function and wellness at the same time.
Well, I would imagine that compared to a 5-minute visit with the conventional doctor, having someone pay that much attention to what's going on in my body would be really comforting to a patient.
Well, that's true. With functional medicine, the intake is at least an hour. We spend quite a bit of time asking a lot of history, detailed history, following by detailed head-to-toe examination, after which we recommend some extensive testing. We try to test for a lot of things so we don't miss anything.
Makes so much sense. Oh, I'm sorry to ask this question, but I'm assuming you get it a lot. Are you a real doctor?
Well, academically, I'm trained as a medical doctor. I'm also trained as a chiropractor, and I'm also trained as a naturopathic doctor. In Ontario, I'm registered to practice and licensed as a naturopathic doctor, chiropractor, and homeopathic practitioner. In functional medicine, the approach again is a little bit different than practicing as either of those professions. So the approach is quite different, and the training is a bit different.
But you get all those anatomy courses. You're fully educated on the body and how it works.
Well, you kind of have to, yes.
Yeah. Well, I hear so much about autoimmune diseases right now. Are autoimmune diseases, no matter what you've got, whether it's psoriasis or what's it, or MS or arthritis, are they all really coming from the same root cause?
In somewhat, yes. In functional medicine, the focus is the gut, intestinal permeability.
Is this the term leaky gut that we hear a
lot?
Leaky
gut,
What does
intestinal
that mean?
permeability. When non-digestible protein goes through the gut lining, and then the body attacks them in addition to a similar like tissue. We call it molecular mimicry.
So the body mistakes this protein molecule for a tissue in your body
that resembles
it. So it starts attacking your body thinking it's a protein molecule.
That's right, autoimmune, right.
It's crazy.
So.
And then however it manifests in that person's body would be psoriasis in this person and cancer in that person. And
so this is one of the approach we take, but we also have to consider other variables. Genomics, we're not all the same. We have to look at lifestyle, stress, mind, body. We have to look at food intake. We have to look at hormones, neurotransmitter balance, the cell, the organelles of the body, the way they work, the mitochondria, which is the powerhouse of the cell. So it's quite complex. It's not just addressing the gut. Even though we say leaky gut is the root cause for many of the autoimmune issues, it's not only that.
What other conditions can be helped with functional medicine?
So pretty much most chronic complicated conditions, because the approach is quite unique, we're addressing the patient as a whole. So we're connecting the dots. It's the medicine of connectivity. We're trying to look at all the systems, all the organs, and even on a cellular level. So it's the approach is quite complex, but it's straightforward also. You know, we always stress, we do extensive testing, we're looking for the root cause, and when we address the root cause and maximize functions, in many cases, the disease either reduced in severity, functions improved, and the patient feels a lot better. That's the ultimate goal.
What about diseases that we seem to think cannot be helped, like ALS? Is there any benefit to using functional medicine in these cases?
Well, you know, depends what you're looking for. I mean, if you're looking for a cure, I would say no. If you're looking for relief, if you're looking for improvement in function, I would say yes. Definitely look at functional medicine. We're always testing for deficiencies, which when you deficient certain chemicals and vitamins, minerals, we're looking for improvement of hormone balance. And many times those patients with ALS or when there's no cure for a specific illness, when they try functional medicine, often they feel better. They feel that the quality of life improves. And sometimes the medications that they're taking works even better. So overall, it's a win-win situation for the patient.
That's great, and which is better for the people who love them, right?
That's right, yeah.
What should someone do if they're thinking, you know what, I think I'd like to try this functional medicine approach? What's the first step?
Well, the first step is to look for somebody who's credentialed functional medicine practitioner, somebody who's registered in Ontario under one of those professional umbrellas. Somebody has experience in functional medicine, that's in many cases of functional medicine. That's about it, looking for experience, training, and referrals. If you know somebody that went to someone who does practice functional medicine extensively, you know, then try them out.
And again, the approach is not to just mask the symptoms, but to get to the root cause, heal that, and the body takes care of everything else.
That's right.
The symptoms, you don't get them anymore because the problem isn't there.
That's right.
Thank you so much. What's a good
welcome.
website or contact information to go if we want more information?
About me or about
you?
About
Well,
me,
or
you can look at the Institute of Functional Medicine. I practice in Toronto. My website is drlevy.ca, drlevy.ca. You can also call the clinic, and if you're outside of the area, we'll be happy to give you referrals for some other practitioners who practice functional medicine.
Brilliant. Thank you so much.
Thank you.